Can dental fillings be replaced? Dental fillings are an everyday dental procedure that is used to treat dentition and improve the aesthetics and function of teeth. In time, they may have to be replaced because of the wear and tear of decay or any other reason. In this clip, we'll look at reasons for the dental fillings could have to be replaced, as well as the procedure for replacement will involve. Reasons for replacing dental fillings. There are many reasons dental fillings may require to be repaired or replaced. One of the most typical reasons is that the filling has damaged or worn out as time passes. This could be a consequence of chewing, grinding, or clenching teeth. These can exert stress on the fillings and make it weaken or even break. Another reason to replace dental fillings is the possibility of decay. If the decay is developing under or around a filling, it might have to be taken out and replaced to stop further injury of the tooth. In addition, if a tooth filling is too loose or is falling out, then it should be replaced in order to bring back the tooth's form and functionality. The material chosen in the filling may also influence its lifespan. Metal fillings, for instance like amalgam, are very durable and be used for years. However, they could have to be replaced when they get worn out or start to leak. Composite fillings, on opposite, are vulnerable to staining and chipping and might require replacement earlier as metal fillings. The replacement process. If you are concerned that your filling in the tooth may have to be replaced, you should arrange the appointment to see your dentist fast as is possible. At the time of the appointment, the dentist will assess the filling along with the adjacent tooth in order to determine the degree of any decay or injury. If it's determined that the filling must be changed, then the very first next step is to eliminate the previous filling. The procedure is generally done using an instrument for dental use to get rid of the filling material, but without causing any damage to the tooth structure. When the old filling has been taken out, then the tooth can be cleaned and prepared for replacement filling. Next, you must pick a replacement material. Your dentist could choose a specific kind of filling based on the dimension and placement of the dental cavity in addition to your own personal preference. Most fillings materials are amalgams, composite resin, silver, and porcelain. When the material for filling is chosen, the material will be inserted inside the cavity, then made to conform to the natural lines that the teeth have. The filling is then made hard by using a special lighting or chemical procedure for a secure and solid connection with the tooth. When the filling has been completed, the dentist will examine your mouth to confirm that your teeth are comfortable and it blends seamless with your teeth. It is possible to experience some sensitivity or a tingling sensation immediately following the procedure. However, the discomfort should diminish within a couple of days. Maintaining fillings. To prolong the lifespan of the dental fillings you have and ensure that you don't need frequent replacements, it's important to follow good dental hygiene routines. That means brushing every day twice while flossing every day, as well as making an appointment with your dentist on a regular basis for appointments and cleanings. It is also important to avoid behaviors that could cause damage to your fillings, such as crushing objects with your teeth and grinding your teeth or opening your mouth with your teeth packages. If you notice any pain or discomfort or any changes of your filling, make aware of your dentist as soon as possible so that you don't cause further damage to the tooth. The bottom line is that dental fillings might need replacement for many causes, such as the wear and tear of use, tooth decay, or harm. If you are concerned that the filling on your tooth could require replacement, it is crucial to arrange the appointment of your dentist to have thorough evaluation and proper treatment. When you are taking care of your fillings and following a regular practice of oral hygiene, you can ensure that your fillings remain in good condition for years to come. Be sure to speak with your dentist on alternatives for replacing your fillings for dental purposes and discuss any questions or concerns you have concerning the procedure.